If helping professionals adhere to the notion of a holistic approach to care for all clients, then the spiritual dimension should be a focus of care, just as for the physical, emotional, and social dimensions. And if one accepts the widely held premise that spirituality is universal to all people, regardless of their age or developmental stage, then holistic care should apply to the care of children as well as adults. This video will focus on the place of spirituality in the care of children and adolescents. While the religious development and experience of children has been the focus of historical research, more recent years have seen the more general concept of spirituality added to the research. For example, in the work of Robert Coles, Rebecca Nye, and David Hay. The word spirituality has a myriad of descriptions, each largely dependent upon a particular person's worldview. How can we describe childhood and adolescent spirituality?
Childhood and adolescent spirituality is first and foremost intriguing. It's exciting because it's such a verification that everyone is spiritual. The spirituality is relevant for every person, and young people as they are going through their normal development and as they try to deal with issues and challenges in life that come to them either personally and individually or in a broader context of family, community and society, that you can see the meaning-making activities. You can see their effort to try and make sense out of things and their effort to try and make sense out of it as they relate to others. And I think a lot of that is what spirituality is, and it's very exciting and very meaningful for young people. They might not call it, in fact they would likely not call it spirituality or talk of themselves as being spiritual and that kind of stuff, but you know, as we get better understandings of what spirituality is and the dynamic of spirituality, I think we see that kids are very much into doing spiritual things.
The family's perspective is very much influencing how a child or an adolescent views their spirituality. Adolescents are at a point that they're probably breaking away and coming up with their own concepts, but children tend to mimic or go along with concepts of their parents. So if their parents have a spirituality or they have a religious belief that gives them spiritual growth, then we see that the children reflect that.
Adolescents are concerned about where they fit into the grand scheme of things. If they were born at another time, would it still be them? Would they still be the same person? They're concerned about the supernatural and the metaphysical, like how do things work the way they do in the world and that kind of thing. It's also a time for adolescents when they might explore and try on different belief systems, so they're vulnerable to maybe engaging in activities that might put them at risk in terms of health. With children, on the other hand, there's less, they don't sort of think in terms of what's my meaning and purpose in life, but they do know when they feel safe, they know what makes them feel secure, and they know the kinds of things that they want answers to, like they're curious about the natural world, and they have an innocence about the way they look at the world. Some people see children almost as a very natural spirituality, that they express it in a way that we lose after we become adults. So they're also spiritual beings in every sense of the word.
As you can see from these comments, childhood and adolescent spirituality is very similar in its focus and description as for adult spirituality. The search for meaning and purpose in life and in life events, a perception of the world, the supernatural or a sense of transcendence, belief systems, and so on. And also for children, adolescents, and adults, the need for and awareness of spirituality is enhanced in times of crisis and trauma. In what clinical situations is spirituality especially relevant? Let's look at some examples from practice.
You could say any aspect of care involves spirituality with children and adolescents, but there are some clinical situations that are more especially associated with the need to attend to spiritual concerns. And I would say the two aspects of my own clinical practice where I have had to be aware of that more intensely than in other situations is when working with adolescents with depression and when working with child or adolescents, I guess, with a history of sexual trauma. The reason, I guess, for that is because it's so close to the spirit, the attacks on the human spirit, and there's a need for healing of the spiritual as well as other aspects of health and well-being for the adolescents.
I remember one particular child. He was about 8 years of age, and he had a very serious diagnosis. He had a type of leukemia, and he wasn't responding to the treatments and so on. So when I went to visit him, he was in his room, and there weren't any family members there and so on. And so I borrowed some crayons and coloring pencils and what have you from the recreational therapy staff, and got him to draw some pictures, and that's what we were doing. But it was absolutely awesome to me. You know, the images that he drew when I asked him to draw, you know, some of his best memories. He drew pictures of his family and his dog and those kinds of things, pictures of the house and those things that children would draw. But when I asked him, you know, then to draw what you see in the future, I mean, he drew an image that you could not help but see it as somehow or other an image of what he would see to be heaven. And it was because somehow or other his religious beliefs and the things that he had exposure to about life and death, nobody had talked to him about where his future was going, but he certainly had a sense that, you know, it wasn't going to be in this world, and it was going to be in somewhere, or it is somewhere that's far more splendid than he was experiencing as in this world right now, because he was very, very sick as a child suffering with leukemia.
We had a young child who was not an emancipated minor refusing care that could be life-saving because of spiritual beliefs. And in that particular case, we had to have a judge come in and rule the child as an emancipated minor in order to have their spiritual beliefs recognized and their care and treatment maintained in relation to their beliefs.
We can see in these comments what is evident from the research, that regardless of whether children are connected to a religious framework or not, they struggle with the meaning and purpose of life or of life events. They struggle with developing personal life-guiding beliefs and values, and they struggle with personal faith issues. All of these are intricately connected to spirituality. Although some aspects of children's spirituality are distinct from development, the expression and experience of spirituality in children and adolescents is certainly influenced by their developmental stage. For example, how a child makes sense of the world is impacted by his or her cognitive development. And we have seen from comments already that the adolescent stage of development, with its focus on identity formation, is a stage where spiritual questioning naturally comes to the forefront. The spiritual needs of children and adolescents are